My name is Dr. Zenas Yu, and I'm an NIHR academic clinical lecturer in dermatology at the University of Manchester. I'm the lead author on this study investigating the risk of hospitalization due to infection in people with psoriasis. Why did we do this study? Psoriasis is a chronic inflammatory skin condition that is associated with comorbid conditions such as diabetes and obesity, which in turn are known to be associated with an increased risk of infection. One concern people with psoriasis have is whether it is also independently associated with an increased risk of getting a serious infection, defined by having an infection serious enough to lead to hospital admission. Several studies have suggested that this may be the case. However, these studies have limitations. For example, one study could not take into account of lifestyle factors that could be responsible for infection risk instead. We therefore wanted to perform a more robust study to find out whether psoriasis truly leads to a higher risk of getting a serious infection. How did we do it? We used data from the UK Clinical Practice Research Datalink. This is a primary care database covering patient information from around the UK and is representative of the general population of the country. We identified adults who had been diagnosed with psoriasis and then identified 6 other people without psoriasis that were matched for age, sex, and general practice with each person with psoriasis. We identified whether they were admitted to hospital for an infection through the linked hospital episode statistics, which are accurate codes that hospitals use to claim for activity-based payment. We then calculated incidence rates for infection and fitted Cox regression models to account for confounding factors, including body mass index, smoking, alcohol intake, socioeconomic status, and comorbid conditions. What were our main findings? We had 69,315 people in the psoriasis cohort and 338,620 in the comparison cohort. They were followed up to a median of 5 years. People with psoriasis had a higher incidence rate of serious infection at 20.5 per 1,000 person years than the comparators at 16.1 per 1,000 person years. After adjusting for confounding factors, people with psoriasis had a 36% increase relative probability of getting a serious infection during the length of follow-up compared with the general population. However, this only translated to 3 out of 100 more people with psoriasis getting a serious infection after 10 years of follow-up compared with the general population. What does this mean? We found that people with psoriasis have a small but increased risk of serious infection compared with people without psoriasis. However, because the absolute increased probability of serious infection is small, people with psoriasis should not be unduly concerned. There was no evidence that psoriasis, however, had a protective effect against skin and soft tissue infections. We recommend that further research investigate whether this slight increase in the risk of infection can be explained by biological mechanisms.